Welcome to Adamawa State, Nigeria, where the immunization plus and malaria progress by accelerating coverage and transforming services impact project is revolutionizing healthcare. Supported by the World Bank, the Adamawa State Primary Healthcare Development Agency launched Impact Project to strengthen healthcare system, improve service delivery, and enhance community engagement. The Executive Chairman, Adamawa State Primary Healthcare Development Agency, Dr. Suleiman Said Bashir, speaks.
Indeed, the onset or the takeoff of the Impact project has really revolutionized service delivery in the primary healthcare subsector in Adamawa State, particularly the immunization which the project focuses. One, it has been able to address so many critical areas of our building blocks in terms of service delivery. We have been able to scale up the span and even the quality of the service delivery. We've been able to improve access to needed care, as well as also improving the coverages because of the access that it has permitted. It has brought a lot of finances to the primary healthcare subsector at the agency level, at the authorities level, as well as at the facilities. This has really transformed into enhancing service delivery at the facility and the communities. The Impact Project has also improved the availability of quality drugs, commodities, consumables, and supplies through the DFF that it has brought to the various facilities. With respect to the infrastructure upgrade, the investment fund of the Impact Project has really improved the availability of needed amenities in the health facility, be it 24 hours power supply with the solarization project, as well as the improvement in the infrastructure, rehabilitation, renovation, and oftentimes reconstruction of many of the service delivery units of the various facilities. The DFF in the health facility has also improved hiring of some casual needed staffs that are not readily available perhaps after some exit before the recruitment process addresses this gap that has been created. So the Impact Project has really been a very positive. I think it was the game changer for us in Adamawa State. Ever since the takeoff of the project, it has always been getting better, and we are heading to the best in Adamawa State. So we want to also use this moment to urge the people of Adamawa State that these services are provided for them and they are of high quality, and we expected a commensurate utilization of these services for the improved productivity and well-being of the people of Adamawa State. We also want to use this moment to appreciate the tremendous support we are getting from His Excellency, the Executive Governor of Adamawa State, Honorable Ahmad Umar Fintiri, who has created the enabling environment and provided the needed guide. Whenever we go to seek some guidance and further direction, he is always there to provide that. And the Minister of Health, the Honorable Commissioner of Health, has always been very supportive. Being the chair of the State Steering Committee of the project, he has been very supportive in the process and has provided the needed leadership that we have set. And I also want to thank Her Excellency, the Deputy Governor of Adamawa State, Professor Kalita Pofrauta, who is the chairperson of the Primary Healthcare Task Force in Adamawa State, who has always been following every step of the implementation of the project and all other primary healthcare activities delivered across the state. So the people of Adamawa State, take this mantra as His Excellency always said, we shall leave no one behind and nothing untouched.
Impact as a project tackles immunization and malaria challenges, focusing on demand and supply sides of healthcare. The project coordinator, Dr. Paul S. Marwa, sheds more light on the project's interventions and contribution to the transformation of healthcare service delivery in Adamawa State.
Impact is immunization plus malaria progress by accelerating coverage and transformation services. That is Impact. Impact is one of the project of Adamawa State supported by World Bank. And Impact is all over the 36 states in Nigeria. It has 4 components. we have the malaria, which is not applicable to Adamawa State. Component 2, which is immunization plus. We have the knowledge change and also the vaccine, cold chain, and logistics. It aims at, strengthening the service delivery and also health system and technical assistance in Adamawa State. During the beginning of the project, which is 2022, Adamawa is one of the states that really paid the counterpart funding, thanks to His Excellency, Right Honorable Amadou Fintiri, the governor of the state, who instantly paid the counterpart fund, and Adamawa is one of the states that started the program. The project is aimed at two things, addressing two things. We have the demand and the supply part of health service delivery in Adamawa State. And the project is doing very well, in the sense that one of the indicators that is being looked at the national level is the indicator of quality of care. During the baseline before the project, we are at 45%, but the recent assessment showed that Adamawa is at 75%, which is one of the best, in the state. So what do the project do in the state? The project do several things, as I mentioned. It is here to improve the service delivery, to strengthen the health system, and also to improve, the immunization services through vaccine, cold chain, and logistics. The project also aims at revamping, and also improving the infrastructure of our health facilities in Adamawa State. At the moment, the project is in 226 health facilities, which cut across every ward in the state. And the project is supporting, improving the structure of the facilities, equipping them with modern facilities, and also giving autonomy to facilities to hire staff to help, in the delivery of the health service in their facilities. We know there has been embargo on the recruitment of health workers in the state, but thank God to His Excellency, Right Honorable Amadou Fintiri, who has employed so many health workers. The project was looking at that before, but because of the massive recruitment that he did, we are not pumping much, resources for hiring of our staff, because 2/3 of the staff that we have in the state are being recruited by this current government. And I learned that he has already also said that we are going to recruit more. So apart from the supply side, we look at the demand side, where we involve the community. There's adequate participation of the community through the community structures. This includes working closely, with the World Development Committee that has been inaugurated just last month, and also the chiefs agents that we are trained from the facility, who help us at the facility level to make sure that health delivery system is at its optimum level in the state. The project is also looking at incentivizing some of the service delivery to encourage women to come to the facility. Services like delivery in the health facility, complete immunization, these are the things that we are looking at incentivizing so that people will come for these services. When this project will complete in 2025, there will be massive changes in our infrastructure. At the moment, we are already started looking at our facility to make sure that all these facilities are improved from level 1 to level 2 as by the National Primary Health Care Guideline, of which some surveys that were conducted before, when we talk of equipment, Adamawa is the best in the state or in the country at large, but we are trying to make sure that through this project we maintain these equipment, and also those that are worn out are being replaced, so that we will still be the most equipped primary health care centers in the country.
The agency, through the Impact Project, is committed to ensuring every child is immunized and every family has access to malaria prevention and treatment. During a visit to the health facilities in the state, the Director of Immunization and Disease Control stressed the importance of the projects to attainment of the immunization success stories in the state.
So far I think it's a project that came and we're still ongoing, and we have looked at what is the impact of it, as you have rightly asked. We are looking more especially in terms of the data improvement and the coverage of the immunization activities. This project was also able to give us to address like 3 critical areas when it comes to immunization. 1, how do you reach those people that cannot be reached in the community? And 2, how do you address missed opportunity, and actually how do we track defaulters of immunization? We bring them back and look at it. So we have so many platforms that this impact project was able to look at. 1, we look at the community-based level and the facility-based level. So these are some of the indicators. So for immunization, we look at one key indicator, more especially the measles 2, and also the penta 3 in the state. Initially, before the coming of the project, from the DHIS to data that we were able to download and review, we also found out that yes, for the penta 3, we were able to lead 103. Initially, the state was actually moving between 98% to 99% in terms of the coverage. Then for the measles 2, the state was having like 45, 46, 47 before the coming of the project. But now, as I'm telling you, we are at 62% coverage for the measles 2. So those things that I've actually addressed earlier, some of the factors that was able to actually bring the coverage to some level of optimization. Then when we look at the use of integrated supportive supervision and data performance to review meetings that we are having across all the LGS and even involving the community leader, we look at 1, who are those that need to actually look at this data. So most of the times we look at only staff that are working in facility, but we found out that through this project we can be able to address some of this activity through World Development Committee, community health influencers, traditional rulers, religious leaders, and other key political office holders that are coming from those communities. I think what we are now saying is that it has given us a better preparation for the implementation of the sector-wide approach of the Honorable Minister of Health and Social Services, in the sense that critically we have been able to look at our data and that will determine our decision-making and performance. I think through the impact project we are able to look at that, because when you take some decisions without an evidence, most of the time you may get it wrong. And also we are looking at how we can implement or integrate some of our findings into the policy document of the National Primary Healthcare Development Agency and the State Health Strategic Plan. So when we look at that critically, I think we'll also look at the issue of ensuring that our annual operation plans are integrated with some of the activities that are incorporated into the impact activities are incorporated into the annual operating plans.
In the same vein, the robust intervention in the space of infrastructural transformation to provide conducive environment for improved quality of healthcare service delivery have translated to the strong community engagements in the 21 local governments of the state. Responding to the significant contribution of the project, respectively at facility and community level, to improving maternal and child health service delivery in the state, the desk officer of the project highlights the story of change.
The Impact project came about purposely to solve the high maternal and child death in the country. As a multi-phase project, the first phase is basically to reduce maternal and child death from 132 to 79 by 2030. So that is the main project development objective nationwide. So as an implementing state, Adamawa will not be left behind. We have the impact project has looked at health holistically, looking at the demand and supply side in order to tackle the high rate of maternal and child mortality. Statistically, if you look at some of our indicators that we use, like ANC attendance, the skill but delivery, family planning, new attendance, and then postnatal care, and then the rest of the indicators that have been used to assess the project. Adamawa State has been doing well. We have significantly improved some of our indicators from the implementation of the project. However, the state, the project has looked at low-performing states, low-performing LGAs, and then give specific or integrated supportive supervision in order to improve the quality of services to an appreciable level, so that the entire quality of care has risen from about 40 to 45 at the beginning of the project to about 75. So a 75% quality of care is a laudable achievement so far. However, we are not going to fold our hands and then stay there. We want to bring all the low-performing facilities to par, so that maternal and child mortality will be addressed. The project has looked at, especially paid attention, close attention to the maternity section of the health facilities. Look at the project has revamped through the investment seed all our maternity or